In this video, you will learn about how HIV medicines called anti-retroviral drugs, or ARVs, work. HIV takes over the CD4 cell, making it a factory that produces many copies of HIV. ARVs work by blocking the different steps in that process. After a person is infected by HIV, the virus flows around in the bloodstream. When the virus bumps into a CD4 cell, the virus attaches and gains entry. ARVs called entry blockers stop this first step. The virus carries instructions to the cell on how to construct new copies of the HIV virus. The message is copied into a different form so the cell can understand it better. This step is blocked by ARVs called NRTIs and NNRTIs. Most people with HIV are placed on these types of ARVs. Next, the viral instructions need to be placed in the central office of the cell factory. A viral machine called integrase carries out this step. There are ARVs called integrase inhibitors, which block this step. Then the instructions are taken out to the cell's factory floor. Machines start to make the virus as one big piece. A cutting machine cuts the big piece into smaller ones, which are assembled into viruses. This viral cutting machine is called protease. This important cutting step is blocked by protease inhibitors, or PIs for short. The last step is for the virus to leave the cells by budding out through the walls. After leaving the cells, they mature before being able to infect new cells. Drugs are under development to block these steps. By combining ARVs, the impact on reducing virus levels and increasing CD4 counts is remarkable. People are living much longer because of this way of treating HIV infection. What can you do to make ARVs work even better? Do not delay having an HIV test done. ARVs work best when HIV infection is discovered early. The decision of when to start ARVs is made by your healthcare provider. Other medicines to prevent or treat infections like TB may also need to be used. Keep all your follow-up appointments at the clinic. As soon as you learn you are pregnant, be tested for HIV right away. ARVs protect your baby from getting infected in the womb and during birth. Once you use ARVs, follow the instructions given to you by your healthcare provider. You will need to take ARVs for the rest of your life because HIV is not curable. If you miss doses or stop taking ARVs, the HIV levels will go back up in your blood. This makes treatment more difficult. By greatly decreasing the amount of HIV in your blood, ARVs help decrease the chance of spreading HIV to others. Practice safer sex or abstinence in order to avoid getting other sexually transmitted infections, such as hepatitis B or C, which can damage the liver, the cervical cancer virus, gonorrhea, syphilis, and many others. As soon as HIV infection is diagnosed, you can help your body to fight HIV by eating healthy foods, getting any infections treated early, avoiding alcohol, managing stress effectively, getting exercise and enough rest. Knowing the facts and taking steps to care for your body can keep you on track for living positively with HIV.